space where we'll explore chemical exfoliation, specifically AHAs and BHAs. The word chemical can sound scary, and acid might make you nervous. But chemical exfoliation, when done correctly, is one of the gentlest and most effective ways to reveal brighter, smoother, healthier skin. There's nothing to fear here, only understanding to gain. Let's begin by understanding what exfoliation is and why your skin needs it. Your skin naturally sheds dead skin cells in a process called desquamation. Every minute of every day, you're losing thousands of dead cells from your skin surface. This is normal, healthy, and necessary. These dead cells are replaced by fresh, new cells that travel up from deeper layers. When you're young, this process happens efficiently. Dead cells shed easily and your skin looks fresh and radiant. But as you age, or when various factors interfere, this natural shedding process slows down. Dead cells accumulate on your skin's surface, creating a dull, rough texture. Pores can become clogged. Your skin may look tired and lackluster. Exfoliation helps remove these accumulated dead cells, revealing the fresher, brighter skin underneath and encouraging your skin to maintain that healthy cell turnover. There are two main types of exfoliation: physical and chemical. Physical exfoliation uses scrubbing particles or tools to manually remove dead cells. Chemical exfoliation uses acids or enzymes to dissolve the bonds between dead cells, allowing them to shed naturally. Today we're focusing on chemical exfoliation, specifically the two main categories, AHAs and BHAs. Let's start with AHAs, alpha hydroxy acids. AHAs are water-soluble acids derived from various natural sources. The most common AHAs in skincare are glycolic acid from sugarcane, lactic acid from milk, and mandelic acid from almonds. Each has slightly different properties, but all work on the surface of your skin. AHAs work by weakening the bonds that hold dead skin cells together on your skin's surface. Think of it like dissolving the glue that's keeping those cells stuck. Once the bonds weaken, the dead cells can shed away naturally, revealing the fresh skin underneath. This surface exfoliation brings multiple benefits. First, it improves skin texture. As dead cells are removed, your skin becomes smoother, softer, and more even. Rough patches diminish. Your skin feels refined. Second, A's brighten your complexion. That dull, lifeless look often comes from accumulated dead cells blocking light reflection. Remove those cells and your skin immediately looks more radiant, more luminous, more alive. Third, Oz can help fade dark spots and hyperpigmentation. By encouraging cell turnover, they help fade areas of excess pigmentation more quickly, leading to a more even tone over time. Fourth, AHAs can reduce the appearance of fine lines. While they won't eliminate deep wrinkles, regular use can soften fine lines by promoting cell renewal and improving skin texture. Fifth, AHAs enhance product absorption. When you remove that layer of dead cells, other products can penetrate more effectively. Your serums, moisturizers, and treatments work better on freshly exfoliated skin. Different AHAs have different strengths and characteristics. Glycolic acid has the smallest molecular size, allowing it to penetrate most deeply. This makes it very effective, but also potentially more irritating. Lactic acid is gentler while still being effective, and it also has humectant properties that help hydrate. Mandelic acid has the largest molecular size, making it the gentlest option, perfect for sensitive skin or beginners. Now let's talk about BHAs, beta hydroxy acids. The main BHA used in skincare is salicylic acid. Unlike AHAs, which are water-soluble, salicylic acid is oil-soluble. This single difference makes it work very differently from AHAs and gives it unique benefits. Because salicylic acid is oil-soluble, it can penetrate into your pores, which are filled with sebum, oil. This makes it exceptionally effective for treating and preventing clogged pores, blackheads, and acne. It's like having a tiny cleaning crew that can work inside your pores, not just on the surface. Salicylic acid works by dissolving the debris that clogs pores, dead skin cells, excess sebum, and other buildup. It gently clears out pores from within, preventing and treating blackheads, whiteheads, and acne. Beyond its pore-clearing abilities, salicylic acid also has anti-inflammatory properties. This makes it doubly effective for acne-prone skin. It both treats the clogging that causes breakouts and reduces the inflammation that comes with them. Salicylic acid also exfoliates the surface of your skin, similar to AHAs, improving texture and brightness. However, its real superpower is that deep pore penetration. So how do you choose between AHAs and BHAs? If your main concerns are dullness, rough texture, fine lines, or hyperpigmentation, AHAs are your best choice. They work on the surface to brighten, smooth, and even your skin tone. If your main concerns are clogged pores, blackheads, whiteheads, or acne, BHAs are ideal. Their oil-soluble nature allows them to work inside pores where the problems originate. If you have combination concerns, perhaps some dullness plus some clogged pores, you might benefit from using both, though not necessarily at the same time. Now, let's talk about how to use AHAs and BHAs safely and effectively. Start slowly. If you're new to chemical exfoliation, your skin needs time to adjust. Begin with a low concentration, 5% glycolic acid or 0.5–1% salicylic acid, and use it just once or twice a week. Pay attention to how your skin responds. Some tingling is normal when you first apply acids, especially AHAs, but there should be no burning, no severe stinging, no lasting redness. If you experience these, the product is too strong or you're using it too frequently. Gradually increase frequency as your skin builds tolerance. You might eventually use acids 3 to 4 times per week or even daily depending on your skin's resilience and needs. But this takes time, weeks or months of gradual introduction. Choose the right format for your needs. Chemical exfoliants come in various forms: toners, serums, peels, and pads. Daily toners have lower concentrations for regular use. Peels have higher concentrations for occasional intensive treatment. Start with lower concentration daily products before attempting peels. Apply acids to clean, dry skin. Water can dilute them and reduce their effectiveness. After cleansing, wait a few minutes for your skin to dry completely, then apply your acid product. Wait before applying other products. Acids work best at a specific pH level. Give them 10 to 15 minutes to work before applying other products. This wait time isn't mandatory, but it optimizes results. Always follow with moisturizer. Acids can be drying, so proper moisturization after use is essential. This replaces any moisture lost and supports your skin barrier. Use sunscreen diligently. AHAs increase sun sensitivity by removing that protective layer of dead cells. You should always use sunscreen, but it's especially crucial when using AHAs. Apply SPF 30 or higher every morning. BHAs also increase sun sensitivity, though to a lesser degree. Don't over-exfoliate. More is not better with acids. Overexfoliation leads to irritation, redness, increased sensitivity, and a damaged barrier. If your skin feels raw, looks shiny, burns when you apply products, or becomes excessively sensitive, you're overexfoliating. Pull back immediately. Signs of proper exfoliation include smoother texture, brighter appearance, easier product absorption, and comfortable skin. Signs of overexfoliation include redness, burning, excessive sensitivity, shiny or tight skin, and increased breakouts. Be cautious about combining acids with other active ingredients. Acids plus retinol, acids plus vitamin C, acids plus more acids. These combinations can be extremely potent. If you use multiple actives, consider alternating them on different days rather than layering them all at once. Who should avoid acids? If you have very sensitive skin, active eczema, rosacea flare-ups, or severely compromised skin barrier, acids may be too irritating. If you're on certain medications like Accutane, check with your dermatologist before using acids. Pregnancy and breastfeeding. Most AHAs are considered safe in moderate concentrations. Salicylic acid in leave-on products should be used cautiously and only in low concentrations, 2% or less. Always consult your healthcare provider. Let's discuss results and patience. Chemical exfoliation doesn't produce overnight miracles. You'll likely notice immediate smoothness after your first use, but significant improvements in texture, brightness, and clarity take time. Give it 4-6 weeks of consistent use before evaluating whether it's working for you. Some people experience initial purging when starting acids, especially BHAs. Purging means existing clogs surface more quickly, causing temporary breakouts. This is normal and usually resolves within a few weeks. If breakouts persist beyond 6 to 8 weeks, it's probably not purging but an actual negative reaction. Storage matters with acids. Keep them in cool, dark places. Some acids, particularly vitamin C combined with acids, can oxidize when exposed to light and air. As we close, remember that chemical exfoliation is a powerful tool for healthier, more radiant skin. Used wisely with patience and respect for your skin's needs, AHAs and BHAs can transform your complexion. But they require responsibility. These aren't products to use carelessly or aggressively. They're potent ingredients that demand understanding, patience, and proper sun protection. Take a deep breath in and release it slowly. Consider whether chemical exfoliation might benefit your skin, and if so, commit to using it thoughtfully and safely. May your skin be bright, smooth, and healthy. May you approach powerful ingredients with wisdom and care. May you find balance in your skincare routine. Thank you for this time together. Be well and be gentle with yourself. Welcome to this calm, peaceful space. Take a moment to breathe deeply. Today, we're going to talk about retinol, perhaps the most powerful anti-aging ingredient in skincare. Retinol has a reputation. Some people swear by it. Others are intimidated. The truth lies in between. Retinol is incredibly effective when used correctly, but it requires respect and patience. Let's begin by understanding what retinol is. Retinol is a form of vitamin A. It's part of a family called retinoids. When you apply retinol to your skin, it converts into retinoic acid, the active form your skin cells can use. What makes retinol special is its ability to communicate with skin cells, telling them to behave like younger, healthier cells. Retinol increases cell turnover. Your skin sheds old cells and generates new ones, but this slows with age. Retinol speeds it up, revealing fresher, brighter skin. Second, retinol stimulates collagen production.
These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments, chemical peels $150 to $300, laser $400-1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies. Start with over-the-counter treatments. Use generic prescription medications if needed. Ask dermatologists about patient assistance programs for expensive medications. Consider community health center dermatology if cost is barrier. Check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments. Bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75, Acne in Specific Professions, Pilots, Surgeons, Healthcare Workers, and Others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: same evening will cause severe irritation. Once your skin is adapted to retinoids alone, typically after 8 to 12 weeks, you might carefully introduce another active on different evenings. Eventually, some people successfully combine retinoids with other treatments, but build up to this gradually. Vitamin C and other antioxidants can be used with retinoids. Apply vitamin C in the morning and retinoids at night, or apply them on different days. Niacinamide can be used with retinoids in most cases, but some people find them together irritating initially. SPF 30+ broad-spectrum sunscreen is absolutely mandatory every single day when using retinoids, even if you don't plan to go outside. Window glass blocks most UVB rays but not UVA rays, meaning significant sun damage can occur even indoors. Reapply sunscreen every 2 hours if you'll be in the sun. Wear protective clothing, hats, and sunglasses when possible. The combination of retinoid use and sun exposure can cause severe reactions and permanent skin damage. As your skin adapts to retinoids over 8 to 12 weeks, gradually increase usage frequency. After tolerating 2 to 3 times weekly for 4 weeks, increase to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. Eventually, many people use retinoids nightly. This gradual progression minimizes irritation and maximizes adaptation. If you experience severe irritation, excessive peeling, or significant discomfort at any point, reduce back to a lower frequency. There's no rush. Building retinoid tolerance over several months is perfectly acceptable. Consistency matters far more than speed. Someone using retinol 2 to 3 times weekly for years will see better results than someone who uses it daily for 2 months then stops. Results from retinoid use appear gradually but are remarkable. After 4 weeks, you might notice smoother texture and reduced comedones. After 8 weeks, reduced acne and early signs of improved skin tone. After 12 weeks, significant acne improvement, smoother texture, and visibly improved skin. After 6 months, improved fine lines, more even skin tone, and dramatically clearer skin. After 1 to 2 years, comprehensive skin improvement including acne prevention, minimal fine lines, even skin tone, and visibly healthier, more resilient skin. Prescription retinoids like tretinoin work faster than over-the-counter retinol. starting tretinoin at 0.025% and increasing gradually can show acne improvement within 6 to 8 weeks rather than 12 weeks. However, prescription retinoids cause more significant initial irritation, making the starting process more challenging. Many dermatologists recommend beginning with over-the-counter retinol to build tolerance, then switching to prescription retinoids if additional strength is needed. Retinoids are teratogenic, meaning they can cause birth defects if used during pregnancy. Women of childbearing age should use reliable contraception when using retinoids and should discontinue use if planning pregnancy or if pregnancy is suspected. Men can use retinoids without this concern. Common mistakes with retinoids include starting with too high a concentration, using them too frequently initially, applying to damp skin, using them with too many other actives, or discontinuing them during the retinization phase. Starting right requires patience and conservative progression. The reward for proper retinoid use is clear, youthful, healthy skin that continues improving even after years of use. Guide 7. Hormonal acne in women, causes, recognition, and comprehensive medical management. Hormonal acne is a distinct type of acne that affects many women and some men, following predictable patterns related to hormonal fluctuations. Understanding hormonal acne's unique characteristics and treatment approaches is essential for women struggling with acne that doesn't respond adequately to standard topical treatments. Hormonal acne typically appears as deep, cystic lesions, often concentrated around the jawline, chin, and lower face. These lesions are painful, tender to the touch, and located deep within the skin rather than on the surface. They're often described as having no head, meaning they don't develop the white or yellow center that surface pimples have. They can persist for weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, PCOS, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with PCOS typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, Yaz, drospirenone, and Bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularities, and breast tenderness. More serious but rare